Welcome to the Pulse of Healthcare. This is Dr. John McCormick. I'm here again with Peter. Hey, Peter. How you doing? Have a good Thanksgiving?
I had a great Thanksgiving. It was, a time of really peaceful, quiet, and thanking for all the blessings that we've received.
I mean, it's awesome. Of course, now that everybody knows this is a seasonal podcast, so happened right after Thanksgiving. They'll be watching in July going, it's not Thanksgiving. Like, too bad. That's what we're recording it. A couple of months ago, we did a podcast and we talked about Stockholm Syndrome and how that my definition of Stockholm Syndrome in the healthcare world is how employers and large corporations are really trapped in this mental cycle of I must be with some big box named healthcare because if I'm not protected and they're scared.
I think the syndrome is getting a lot worse because people are starting to see real prices, and it's what was something that could happen in the future is now a very harsh reality.
It really is. It really is. So I felt like I should take that maybe one step further because in some cases, you do have employers that, either are looking at the new quote that they just got for their renewal and they're having serious sticker shock. Their heart palpitations. But then what do? They pick up the phone. They call the same agent or broker that they've always had. And the agent or broker goes, oh my God, let me take care of that for you. And what do? Do they really take care of that employer? Are they really charging out and going, let me break you from this cycle of insanity where your rates go up every year and your benefits go down every year and you don't really know what's going on and all the money flows into this black box? And I mean, I can look at Wall Street and tell you how many billions of dollars those companies made, but all I know is I'm paying 30% more this year than last year, and that was 20% higher than the year before and 10% higher than the year before because it just keeps going up and up and up.
Yeah, no, and all the people that are on the Medicare and Medicare Advantage programs, they haven't seen it yet. They've heard about it, but they haven't seen it.
It's coming. It's coming, and it's coming. It's coming for the commercial plans like we do. It's coming for the ACA plans. It's coming for Medicare and Medicaid.
And it really hits the small businesses and medium-sized businesses really hard. They don't have any special negotiations. They don't have any special contracts, and they're the ones that are paying the full freight.
And they're certainly not healthcare experts, right? So
right.
That's why we rely on those brokers and agents.
Right.
And so, as I disclosed before, I actually am a trained FBI hostage negotiator. And so these kind of things trickle in my mind, and I go, yeah, but if you're calling the same broker or agent that puts you with your original captor, is he going to take you out of that relationship, or is he just going to move you to another big brand, effectively just shifting you from one captor to another?
Right.
All right? And I don't want to beat on agents or brokers because there's some amazing ones out there. Some of them that work for some of the large corporations, a lot of them that work for the smaller operations that really are looking out for their particular customer, client.
They
really
take a
are
lot of
trying to innovate.
education, a lot of ongoing continuation, a lot of training. They are really helpful people. There are a few bad apples.
There are, and I hate to say there's probably more than a few bad apples, but that's maybe not by intent, because what do? We put people with what we know, right? And if I'm somebody that's representing one of these big box companies, what do I know? Big box companies, and so I may know 4 or 5 of them, right?
Right.
And so if company A is blowing up my client's premium and they're screaming at me to help them out, I'm just calling company B or C or D. But all I'm really doing is moving my hostage from one hostage taker to another hostage taker, and I might in the short term improve their circumstance because maybe they get a rate break that year,
Right.
but next year they're right back in it, right?
Right.
So they didn't actually fix anything. They just moved the problem around, which is ironically exactly what exactly what the actual hostage takers like the Taliban and ISIS and all that actually do. They actually move their principal hostages around inside of their own known network, and that's to avoid that person from escaping, right?
Right.
So my job as a broker, because that's how I eat, is to earn commissions. I want my employer not to escape my circle of friends.
Right.
Except my friends are very limited, and therefore my selections are very limited. So where I might not be a bad human being, or even not trying to do what I consider to be the right thing, I'm limited by my circumstance that I only know what I know, right?
And what do people want to avoid? Patients want to avoid not having the service that they need. An agent doesn't want a plan that he sold to blow up on him or to cause problems for his clients. Even with all the price increases, those blow-ups are still continuing.
Always.
Nothing is going to change other than you got a deeper hole in your pocket.
Absolutely, and they occur with all the big box companies too. So anybody that tells you otherwise is not being forthright. Anybody that tells you won't ever get a balance bill, or you're going to be told you're out of network when you thought you were in network. All of those things happen all the time. The difference is when it spitballs out a battleship, right? You're not going to sink it. So if you're railing against one of these big box companies, they don't care. Okay, thanks for calling. Click.
Yeah.
What are you going to do? What are you going to do? And I've said it many times. No HR has ever gotten fired for putting somebody with a big box company because they go, well, that's the best company out there. Yeah, but it's the Titanic. It's sinking.
Yeah.
and you got us on the ship. All right. Whether we realize it's sinking or not, at least we're surrounded by golden furniture. So my point is, what we have to do as the innovators in this industry is that we have to help educate the agent broker class and let them know that there's a better way. Yeah. All right. Let them know that there's options and differences. And I think we've done that. There's a lot of emerging communities. You're seeing that a lot with the direct primary care. You're seeing that a lot with some of the symposiums and things that are going on. I happen to be speaking at one in February. If you guys want to come out. It's called the U-Power Symposium. It's in Savannah, Georgia, first week in February. So look for it.
Anyone that can should come out and meet Dr. John.
Right. I mean, I'm a lot of fun in person, too. I'm not just funny on the show. I'm actually kind of funny in person. Anyway, so what we want to try to do is help educate people that there are better ways. Yep. And when I say people, I mean brokers, because it's really a collaborative kind of relationship, because first we got to help the employer overcome their mindset of I must have, all right, and be willing to take that chance. Not just from an economic standpoint, but from an emotional standpoint, because that's what we're talking about. Right. It's their emotional investment, because they're already done with the financial stuff, right? By the time they're looking around, it's like, oh my God, but now they're still emotionally tied to it. So now you have to have a broker that's really kind of acting like a counselor to put their arm on them and go, no, come with me, young Padawan. There is a better way. Yeah. Right?
Exactly.
And I can show you that better way, and we know that it works, and it's been working historically for many years. So I guess what I want to say is, there is a better way. And if we can reach out to that broker agent community and help them break the cycle, all right, yep, instead of being a participant in the cycle, I think there's a huge value in that.
Well, we really want to educate the market to the best way for them to get the coverage that they need and their employees enjoy at a cost that they can afford.
In a sustained way.
Yeah.
I think that's the most important, in a sustained way. Because if I'm running a small business and one of my products or services goes up 10 or 15 or 20% a year, it's impossible for me to manage that in a budget. If I have a limited customer base and a certain amount of sales and one of my costs is out of control, ultimately I have to cut that cost, cut that benefit or whatever. And then the knock-on effect of that is I might lose my most valuable employees because now a benefit that they needed or counted on is gone.
Yeah, it's interesting because some of the agents that I've talked to, and certainly some of the customers that I've talked to, they're afraid of being sold, and that's not what we're based on. We're based on education.
We really are.
I mean, and that's the frontier we're fighting, is how to educate the agents, the brokers, and the businesses how to best take care of their health care for the long term.
Absolutely. So I guess the final close here is, if you're an employer and you've got sticker shock and you're calling your agent or broker and you discover that they really don't know anything outside the big box stores, we want you to know that there's other solutions, all right, and you can reach out to us. If you're a broker or an agent and you're looking around going, I really would like to give my employers another way, maybe that I can get them in something that's sustained, we're happy to work with you too.
I really think that if you're an agent, you really need to learn about this, because you're not offering your clients a wide variety of solutions that will meet their needs. It's not being sold, it's being educated, and as an agent and as a wholesaler, you need to do the right thing for your customers.
Absolutely. Well, you can always reach us at 866-549-4199. You get to talk to a real human being. You can ask for Peter. He'll take your information. We'll get you set up. Thank you very much and welcome. Thanks again for listening to The Pulse of Healthcare.